Now for the next presentation, I would like to call Dr. Uzma Rajar. She is an associate professor and chairperson and head of the department at ISRA University Hospital, Hyderabad. And her topic of presentation is to evaluate the risk of melanoma development in a patients with large congenital melanocytic nevus.
Assalamu alaikum, my dear chairman and co-chairmen, dear Professor Daulat Rai Bajaj and other dear colleagues. So the topic of presentation is congenital melanocytic nevus is considered a risk factor for melanoma. Background of the study: moles or melanocytic nevi are both markers of an increased risk of cutaneous melanoma and direct precursor lesions. Recent strategies to reduce the burden of advanced diseases have focused on early detection and ongoing surveillance of moles for malignant degeneration. Inherent in this approach is the notion that moles exhibit a certain risk of transformation into melanoma. However, this risk is unknown. The objective of the study was to evaluate the risk of melanoma development in patients with congenital melanocytic nevus seen at dermatology OPD at ISRA University Hospital, Hyderabad during a 5-year period from January 2013 till January 2018. To best of our knowledge, there are no published similar studies on congenital melanocytic nevus and on melanomas in Pakistan. Introduction. Although the incidence of cutaneous melanoma has increased dramatically during the past several decades, earlier detection of lesions has led to a greater percentage of curable lesions. In 2002, the American Society estimated 53,600 cases of cutaneous melanoma with only 7,400 deaths attributed to the disease. So it shows that it is a curable disease and people are doing work on that. Current strategies to minimize the morbidity and mortality associated with cutaneous melanoma focus on sun protective behavior and scrutiny of individuals with identifiable precursors and markers of risk such as moles, also known as melanocytic nevi. The presence of multiple moles has been shown to be associated with greater risk of cutaneous melanoma. Retrospective case control studies have found a direct relationship between number of moles and risk of cutaneous melanoma. Many of the current efforts to rise in melanoma have centered on the detection of early changes in melanocytic nevi. Benign and atypical moles have been shown to exist in histological contiguity with cutaneous melanoma, suggesting that these melanocytic proliferations are also susceptible to malignant transformation. The asymmetry, border, irregularity or changes in the border, color, variation in the color or changes in the color, diameter increased or irregularity of the diameter, campaign and mole mapping approaches rely on the fundamental supposition that moles can transfer into cutaneous melanoma with time. To date, however, this rate of transmission has not been calculated. Given the tremendous number of nevi in general population and comparatively limited incidence of cutaneous melanoma, we thus set out to calculate the rate of transmission of nevi into cutaneous melanoma by means of population-based estimates of cutaneous melanoma incidence and number of moles. methods of the study. The prospective study started in January 2013 and included all patients with congenital melanocytic nevi evaluated in the Department of Dermatology, Isra University, Hyderabad from January 2013 till January 2018. The study was approved by Ethical Review Board of the institution. A congenital melanocytic nevi was defined as a melanocytic nevus present at birth that has a diameter of 0.5 centimeter to 5 centimeter. Data from each patient included age at the first appointment, gender, skin color, characteristic of nevus, that is size, location, number of satellite lesions around the nevi, follow-up period, personal and family history of melanoma, any type of treatment they got for their congenital melanocytic nevi, and family history of congenital melanocytic nevi. हाँ जी, इसको करना अच्छा. हाँ जी. The follow-up period was defined as the interval between the date of the first and last visit or contact, or the date of melanoma diagnosis when applicable. Follow-up was performed during the patient's periodic appointments at the clinic. In few cases, information was updated through phone contacts as well. Patients whose follow-up was less than 1 month or those who had a diagnosis of melanoma before entering the study were excluded from statistical analysis. Survival was calculated by the Kaplan-Meier analysis. Thus it was possible to determine the cumulative risk of occurrence of melanoma in this population over a 5-year period with 95% confidence interval. 16 of the 120 patients recruited were excluded, 15 for insufficient follow-up time, less than 1 month, and 1 who had developed a melanoma prior to the enrollment. Median age at baseline was 12.6 years. 20 patients